And I'm Kelsey Correa.
And we are chief residents at the Brandon, Florida NYU Langone Pediatric Dental site. So we're just going to talk a little bit about our program so you can get a better idea of what goes on here in Brandon. So we're here in Brandon, Florida, which is about 15 minutes away from Tampa. So a lot of times we refer to ourselves as the Tampa site as well. And our director here is Dr. Richard Giles, and our director of dental operations is Christina Castillo, and our clinic administrator and attending is Dr. Priyanka Iyer. So we'll start with telling you a little bit about Florida. Florida has the longest coastline of all the states in the contiguous U.S. So if you like the beach, it's definitely a good place to be. We're about 45 minutes from the beach here in Brandon, so super close. You can take day trips on the weekend when you're not on call, of course. We're also the largest producer of grapefruits and second largest producer of oranges in the world. So if you're a big citrus person, this is the place for you. Also, if you're big on Cuban sandwiches, that was actually invented here in Tampa's Ybor City. So we've got really good Cuban food. You definitely have to have a Cuban sandwich when you come interview here. And Florida is the only state where both crocodiles and alligators coexist. So it's a fun fact for you. There's also manatees here. I've seen manatees while I'm out kayaking, as well as there's a manatee viewing center about 15 minutes from here. So you'll definitely see some manatees if you come to the Tampa area. So also there is a lot of poverty here in Florida. There's about 24% of children living in poverty here. So there's definitely a need for dentistry and better access to dentistry for children here. So our community health clinic is a great resource to provide better care for these children who don't have insurance or are on Medicaid and having trouble finding a dentist that provides Medicaid. So a little bit more about that. 9% of children in Florida did not have health insurance in 2014. Also, 1 in 2 children rely on Medicaid for their health care. About 23% of children did not receive preventative care in the year 2000 to 2012, and only 32% of Medicaid-enrolled children received any oral health care. So, you know, even the children that have Medicaid aren't necessarily getting the care they need because they have a hard time finding a dentist that will take Medicaid. And then there is still children here that don't have Medicaid. We get a lot of children that weren't born here, so they're unable to get health insurance. So our sliding fee scale here at the Community Health Clinic really makes dental care more affordable for those children. And that way we can prevent so many children from going to the dentist just for emergencies, because that does end up being more costly and more traumatizing for the child. So here's a picture of our main clinic site here in Brandon. We have a really nice new facility here, and our site is called Suncoast Community Health Center. Their mission statement is to be committed to improving the health of our communities. The vision statement is to be the first choice for healthcare in the communities we serve. And our value statement is mission before self with empathy and compassion. So we provide comprehensive services at our clinic here, including restorative, endodontics, oral surgery, trauma, interceptive ortho. We do phase 1 ortho here. Every Friday is ortho day where we have orthodontists come and help us do some of those phase 1 cases. So that makes us unique from some of other programs that may not have as much ortho. We also see a lot of early childhood caries, so we do a lot of management of that as well as preventative services, and we do treatment in the OR at Tampa General Hospital as well as South Florida Baptist Hospital, and we're just adding on another hospital, so I think Kelsey's going to talk about that a little bit more on another slide. We also provide in-office sedation dentistry, as well as oral health and nutrition counseling, and we do have education and outreach community programs that we participate in as well. We see a lot of patients here, so just to give you some numbers, in 2017 we saw a little over 18,000, and in 2018 we're almost up to 19,000, so I'd say we're probably above those numbers now. Definitely didn't go down in numbers. We see a lot of patients, and most of our patients are on Medicaid, and then we do have some that are uninsured or take other insurances. So a little bit more about our residents and our faculty and staff. Here we have 5 full-time pediatric attendings. There's 3 at our main site here in Brandon, and then we also have a full-time attending at our clinic in Plant City and our clinic in Palm River. And then we have 3 part-time attendings that usually come in once a week. So it's great to have a lot of different attendings to get different perspectives on treatment plans and how to manage different patients. And then, like I was saying, we do have some part-time orthodontists that come on Fridays each week, and we do have a part-time oral surgeon that will come for consults as needed. So there's 10 of us residents here, 5 in each year, and we have one big resident room. You can see it there in the bottom picture. It's kind of like a long room in between the hallways in our clinics, and we each have a workstation there, and that's where we have a lot of fun talking about all our patients that we've seen that day. And we also have a residency coordinator here, as well as our administrative coordinator, Dr. Adia, who's based in New York. We have our director of dental operations. We have 3 front staff to help with scheduling our patients. We have an OR coordinator, 1 clinic administrator, 2 DA coordinators, 20 dental assistants, and 1 sterilization tech. So we've got a big team here, and we keep things running pretty smoothly. It gets a little chaotic at times, but it's awesome that we have so much support from the staff here, as well as a lot of dental assistants. You'll never be without a dental assistant. So the pediatric dental clinic is just one part of the clinic here at Suncoast. They also have other services. They have pediatric medicine for adults and children, as well as behavioral health, optometry, pharmacy, social services. So we really want to focus on, not just that patients are being taken care of their oral health, but also, overall health. So if we see that someone doesn't have a pediatrician, we can refer them to our pediatrician here, and same goes for, they often refer patients for a dentist to us. We are like the Costco of health clinics. And within our pediatric dental clinic, we have 13 dental operatories, 8 of which are private rooms, and then we have 4 seats in the open bay. We have a sedation suite, and then a small room for the sedation recovery, and we have panoramic, lateral ceph, and cone beam CT capability here in the clinic. So here's a picture of our sedation suite. It's different in that it's bigger than our other operatories, and it has all of our emergency equipment in there so that we're prepared for everything and anything. Normally here we're doing mostly oral and intranasal sedations, but in some cases we may do intramuscular or more rarely IV sedation. Agents we typically use are hydroxine, midazolam, meperidine, and triazolam. And as you can see, we have a TV. Oops, let me see. There we go. We have a TV above our chair there. We have TVs in most of the rooms, and hopefully by the start of next year, we'll have them back in all of our rooms, which is just really awesome to distract the kids, kind of keep their mind off things that are going on during treatment. And then in the bottom left photo, you see our front desk area, and the bottom right is our sterilization. And we do have a sterilization tech that keeps things moving along. Also in our sedation suite, we have access to a Solea hard and soft tissue laser. So you'll have the opportunity to do like frenectomies, gingivectomies with the laser, as well as even do cavity preps with the Solea. And the CO2 soft tissue laser as well. We use less, but in cases of gingivectomies usually. All right, and then our other clinics that we do some rotations at, we have a clinic in Ruskin, which we do our pediatric medicine rotation for 1 week there. We also have a community service rotation there where we go out on a mobile bus to provide screenings and sealants to children at schools in the area. And at this clinic, there's 6 patient rooms, and they participate in a Reach Out and Read program and Vaccines for Children's program. So it's nice to just kind of get a different perspective and see some of the programs that they have going on at other clinics, not just what we're doing in Brandon. We also have a clinic in Plant City. That's the one on the bottom left there. And in our second year, we rotate to this clinic once every 5 weeks. And so you're the only resident there with 1 attending. So it's kind of a time for you to have a little more independence in seeing patients, and also, again, just get a different perspective with other attendings and see a little different patient population. And then lastly, Palm River Community Health Center. Right now we are just starting rotations there, so it's new to us, but we may be doing more rotating there in the coming years.
All right, and so now that we know about all the facilities for Suncoast, we're just going to go over a couple hospitals that we're affiliated with, and also a resident experience here. So we do go to Tampa General Hospital, which is a level 1 trauma center. So we do most of our rotations there, which includes anesthesiology rotation, pediatric emergency medicine, inpatient rotation, and then some subspecialty rotations there. So when we go to the OR, we go to there once a month there. And then also the place that we go to is South Florida Baptist Hospital, which we are going every Thursday currently. So that's located in Plant City, and we also do take call there as well. And a new hospital that we just are going to start going to is Brandon Regional Hospital. So we also will be taking some GA cases there. So for our OR experience, so we have a lot of patients on our wait list here to get seen in the hospital. So we're lucky to have multiple hospitals we can go to. And so each resident goes with an attending and performs about 3 to 4 cases per day, and it's really nice because you get that one-on-one experience with the attending. So you'll get to learn a lot there, and then be able to take those experiences back to clinic, help with speed and just being able to problem solve in clinic. And also we do take on-call. So we go for on-call right now. We're going to Tampa General and South Florida Baptist Hospital. And so you're never on call alone. You're always with a PGY2 for first years. So the PGY1 is first call and the PGY2 is second call. And you're always paired. You're on call about every 5 weeks. And then you'll go in together and then be able to figure out and problem solve. And then, so here's about some encounters of how many patients we've taken. It just keeps going up, especially South Florida, since we're going more often. So for Tampa General Hospital, our wait list is about a year long. In South Florida Baptist Hospital, we do see them a little bit quicker, but so we get a lot of OR experience. And then for sedation, so Leslie was talking a little bit about our sedation suite. So this is also something we pair up for. So 2 residents are assigned to sedation together. You see about 2 to 3 cases on a sedation day. So you'll be working up those patients and then get to do it in clinic in our sedation suite and then the recovery room. So you'll be doing that. And also what you talked about a little bit earlier is ortho. So we do phase 1 ortho on Fridays we have 3 attendings, as she mentioned. And which is also great is we get to do seminars with one of our faculty. And so it goes over just the basics of phase 1 ortho, explaining why we're doing things, and explain better concepts of how to correct like anterior posterior crossbites, functional shifts, importance of palatal expansion, molar uprighting, and then how to correction of ectopic eruption of teeth. And then going along with those hospitals, like we mentioned, so we do have rotations that we go on. So for PGY 1 year, you do anesthesiology at Tampa General Hospital. So that's about 22 days that you're there. You get to be with the anesthesia team, start IVs, intubate, learn how to bag mask, and be able to take those skills into your sedation days as well. So in that rotation, you're there for most of the day, and then we go into emergency medicine, also at Tampa General Hospital on those days, and that's a pediatric ED experience. So you'll be shadowing the residents, the medical residents, and getting to work with them in the pediatric emergency department at Tampa General. And also a pediatric medicine rotation is 5 days with a pediatrician, and that's at one of our Suncoast sites. At the Ruskin Suncoast site, and that one you get to shadow the pediatrician, get to see what they do on their side, and also get to see stuff about vaccination schedules and ask questions about the medical side about treating kids. And then in your PGY 2 year, we do have a couple more rotations. We have the inpatient pediatric medicine for 5 days. Subspecialties is for 4 days, and those are both going to be at Tampa General. And then for our teaching rotation, we go 5 days and we go to LECOM, which is a dental school that is near our site. And then we have a community health service, which is 5 days, and that's on the mobile bus, which I believe we have a picture of. Okay, and so like I was mentioning, the mobile dental program. So we have it's a Smile Every Mile. It's a large bus that has a couple chairs in it that they're able to do exams on. So you'll go on this with our community service rotation and get to go to nearby schools, get to do fluoride, sealants exams, prophies, and OHI, and then we'll refer kids to the Suncoast Brandon site to see if they need any treatment. And a new rotation that we started rotating on this year is the craniofacial rotation. So we get to, for PGY2, you get to rotate theirs on Fridays. So that's a new rotation. And then the teaching rotation, which I mentioned, is at LECOM Dental School. So you'll be helping the dental students in the sim lab, and then also getting to give a lecture to them about common pediatric topics. And then one of the requirements for CODA and also NYU is to do a research project. So these are the steps that you'll have to go through for your research project. And the nice thing about being in one of the NYU program is that there's also group projects that you can join, and then also get to get help working through these steps. So for research, you'll work with an attending as your mentor, and also get to work with NYU directors as well, just to get through these steps. So this is a requirement for all residents in all the programs. And then going along with the mobile bus, there also is some school fairs that we go help out in the community. So usually in the beginning of the year, they have an annual school health fair, which I hope by that time they restart again. So we go out there, just give OHI, get to do quick exams, and it's a fun time. And there's also Give Kids a Smile, which is at LECOM, the dental school. So we also go help out there as well. So lots of community service opportunities. And then just for fun, every year there is a competition among the NYU sites for a Halloween costume competition. So as you can see, Tampa site does represent quite a bit. We were winners in 2014 and 2016. And as our co-residents say, it's only on even years. So unfortunately didn't win last year, but maybe this is our year. And then, see, 2018. And this year, we just looked really cute. And then last not least, but Dr. Pence mentioned that we do have fun in the resident room. We're all going through residency together, so that resident room is a nice little area for us to say funny stories or what's going on in clinic. We do have lots of stickers and prizes for the kids, and always open to new ideas for what to do in the clinic. And then on birthdays and some other holidays too, we do celebrate together with all our staff, and hopefully you'll get to try Leslie's cake before she leaves. And that's it. Thank you guys so much for listening, and if you guys have any questions, you can feel free to reach out to our site, and Leslie and I will answer any additional questions that you have.
We look forward to seeing you in November, virtually, of course.